Hi, my name is D.Mazia, and I am a student here at Aspen University. Today we're going to talk about the eye, and I'm going to explain the eye and as well as 3 common eye disorders, okay? So we'll get started off here with the diagram, just an overall of what you can see. Okay, so first I'm going to talk about the pupil. The pupil is going to be the darkened black area of the eye. The pupil is the function to let in light and focus it on the retina, okay? And then you have the sclera, which is that white part of the eye. The sclera provides protection from the outside elements and provides form of the eye, okay? Then you have the colored up portion of the eye. On this person, it is blue. So the iris regulates the amount of light entering the eye. So when you have low light, the iris will open up the pupil to let in more light. So those two work together. And then you have the lens here. The lens is going to be this white area in the picture. The lens bend light rays so they can focus on the retina, which sends a photo to the optic nerve and then process in the brain. And then you have the aqueous humor. The aqueous humor here is what keeps the eyeball moist at all times. It nourishes the lens and the endothelium of the cornea, okay? And then you have the suspensory ligament here. The suspensory ligament, it connects the lens to the ciliary body, okay? And then you have the choroid. So I have it up here, one of these layers. The choroid supplies the outer retina with nutrients and maintains temperature and volume of the eye. So a pretty important function there. And then we have the retina here. The retina is kind of more towards the back. The retina is the innermost layer of the eye, and it converts images into a form of the brain that the brain understands and processes as a vision. Okay. Next, we have the fovea here. The fovea provides the sharpest visual acuity and is located at the center of the macula. Okay, we have the optic nerve here. Like I said, this is where the light is sent through to the optic nerve. It transmits visual information from the outside world to the brain for processing. Okay, and then you have that central retinal artery and vein, which supplies blood to the retina here. And then you have the macula. I don't have it on here. The macula is right between the fovea and the retina, and it's the focus and central vision. Okay, so now we're going to move on to our first eye condition here, and that is going to be cataracts. Okay, so I have all of the labels structured here. But what the area affected for cataracts is going to be your lens, your macula, and your optic nerve. And the signs and symptoms of cataracts is blurry vision. The reason that they have that blurry vision is because we have some buildup of protein that blocks that area, so you are unable to see. The diagnostic studies for this to find cataracts is visual acuity test, which tests how well you can read a series of letters. Okay, and you have the treatment and management. If they can't be fixed with prescription glasses, that's when they'll go in with surgery and they'll have corrective lens fixed. It's a synthetic clear replacement, and it can be done on an outpatient basis. Okay. So the interprofessional care is you'll be seeking as a primary care doctor, and that'll be for follow-up and for surgery purposes. Patient teaching with this is if surgery is performed, includes telling the patient not to drive for 2 days or as instructed by the healthcare provider. Do not drink alcohol for 24 hours. Avoid bending at the waist or lifting heavy objects for 2 days, because we have that new operation there, so we want to be careful. And then relax after 24 hours of surgery, and TV and reading is okay for that. Okay. Next we have glaucoma. As you see, I kind of labeled what's going on here. There's 2 types. There's open angle glaucoma and closed or narrow glaucoma. Closed or narrow glaucoma is the worst, but we will review open angle first. So in general, glaucoma affects the iris, the optic nerve, and the lens. Signs and symptoms of glaucoma is nausea, redness in the eyes, blurry vision, halo vision is a key here, and no peripheral vision. Okay, so they can only see what's outside of here dependent on where the pressures come in. With open angle glaucoma, the pressure is coming out to lubricate the eye from the aqueous humor, and goes past the lens and out through these ducts. But these ducts are either clogged or unfunctional, so it goes back into here, causing more pressure. Okay, so that's why you'll have the increased pressure there. So diagnostic studies for this one is tonometry, which measures the inner eye pressure. Normal pressure is between 12 and 22 meters of mercury. With glaucoma, often pressure is at 20 millimeters of mercury. Then you have the ophthalmoscopy, which dilates the eye exam, measures the shape and the color of the optic nerve, and eye drops are used to examine the shape and color of the optic nerve by dilating. Okay. Then you have perimetry. It's a visual field test. Examine the complete field of vision. This test, the doctor would look at the patient straight ahead as the light is repeatedly shined in different areas to map out the eye. The doctor can also do gynoscopy, which examines the angle in the eye where the eye meets the cornea. So eye drops are used to numb the eye, and there's a mirror that the doctor would use to see if there's a blockage between the iris and the cornea, which is closed, or would be wide and open, which indicates open angle glaucoma. Okay, or we have pachymetry. It's the last test that we have. It examines the thickness of the cornea. So it's a painless test, and the doctor will measure it by putting a probe on there and measuring. Okay. Treatment for this one is going to be lowering eye pressure and intraocular pressure, and you can do that with prescription eye drops, oral medications, laser treatment, surgery, or a combination of all. Okay, interprofessional care is also going to the doctor, see an ER physician if it is closed glaucoma, just because it can prevent permanent vision loss. The health promotion and education with glaucoma is to not touch the eye to reduce infection. Home safety tips like walking slowly, using up and eye down movements to view stairs and oncoming objects. Okay. So now that I explained open angle glaucoma, let me show you closed angle glaucoma. Okay, so with this one, instead of it going out into the lens and going out the duct, it is through this closed angle here. So if I were to scribble it in, it's going through, but because it's such a closed off angle, it automatically is shifted back and created more pressure than open angle glaucoma. This one doesn't have any escapage at all, so it is worse, and that's why it's increased pressure. Unlike open angle glaucoma that can go out, and some of it is released to the sclera, but at very slow process. Okay. Last eye condition that we have is macular degeneration, and I did learn that the leading cause of vision over 10 million Americans is macular degeneration. It's more than cataracts and glaucoma combined, so pretty important for teaching and purposes like that. Okay, so the areas affected is a deterioration of the center portion of the retina, which is the back layer of the eye that records the images that we see via optic nerve from the brain. Okay, so signs and symptoms, it doesn't affect the peripheral vision, but you do have a hard time focusing on close-up objects like faces, road signs, knitting, and all that kind of stuff. Diagnostic studies, we have tonometry, visual acuity, and the Amsler grid test. The Amsler grid test is appropriate for macular degeneration because it is a self-administered test, and you use one eye at a time. The patient will fixate on a center dot and record any abnormalities of grid lines, such as wavy, misty, or distorted areas. Okay, so as we see, the macula here for macular degeneration is not working. Usually it's a cause of fatty tissue or just deterioration itself. Okay, so the treatments is they have vitamins and antioxidant therapy, or participate in diet, exercise, avoiding smoking, wearing sunglasses, and the end result would be surgery. Okay, so interprofessional care, you would seek your primary care doctor for initial assessment and follow-ups. And education on the causes of macular degeneration is poor diet, overweight, so teach about exercises and nutrition therapy. Also requiring a dietitian. Staying away from sunlight. You can also be at risk if you had family history of age-related, high blood pressure, and smoking tobacco. So just kind of things that we want to teach our patient about is obviously not smoking, improving the diet as much as possible, because macular degeneration is not fixed with prescription glasses or eye drops. Is fixed with surgery. Okay, and this is an age-related disease, so something to really let our patients know. Thank you.